Hello and welcome to this month's Fire Chief's video message for December 2022. Welcome, Pete.
Thanks, Chief. The end of the year, wrapping things up, but certainly has been busy.
Yep, we're back here at the EOB. Things are working together at the PIO team, so not at 32, and hopefully getting back in the studio upcoming here shortly. As you said, since we talked last time, there's been a lot of activity and some pretty unique calls in the experience of those attending and in MCFRS history. So let's talk about the Quince Orchard building explosion.
Yeah, certainly we've seen that before, and that was a unique set of circumstances. A lot of great work by first responders and by the community. We're unfortunate that one person did not survive, but believed to be an intentional act, but otherwise everybody got out. And that time of the day, the potential for life, for loss of life and injuries is great. But we dodged a bullet on that one for sure.
Indeed, when ECC dispatched the call and says they have multiple reports of either the elementary school across the street, Brown Station, the pool house, which was across the street, and the community center or the building, the apartment building, all three of those are bad. Each one of those has different target hazards. It was just about 8:30, so elementary schools are in the final processes of people arriving and starting their day. So great work done by the crews arriving to indeed find an explosion in a 4-story from the rear, 3 in the front apartment building with significant fire involvement. So 14 or so folks treated by fire, 10 transported. Yes, 1 loss of life, some great work. Like Littonsville, like Arliss Street, a whole of government response to the event with our public safety partners in emergency management and police, city of Gaithersburg as well as county here, Health and Human Services, as well as our nonprofit and community teams. So great work, and those folks will be needing assistance for weeks and months to come. And as people may have heard me say, that's an example of an elephant. You just take one bite at a time, you attack the different parts of it, and great work by the team of folks that were there that day. So shortly after that, we turned to lights going out across the county and another airplane incident.
Yeah, and that was only a week or so after that. We had that interesting complex situation where the plane ran into the power tower up there in Goshen Road, off of Goshen Road, and that was a protracted incident. Certainly a lot of great work by our technical rescue, EMS, and our partners in PEPCO specifically.
Stations across the county, experienced a power outage. At one point, there was 120,000 PEPCO customers, ranging from Gaithersburg all the way down to Silver Spring and Olney, Wheaton, throughout a wide path. Without power, stations had the power go out, then looked up on their station alerting screen, and now there's a small plane, crashed in Station 8's area, and calls were flooding the ECC pertaining to that. Engine 708 clearing another call, gets there pretty quick, and sure enough, as this picture outlines, it's not a small plane crash that we would be normally thinking about. It's a small plane stuck in the transmission tower, which is a lattice-style construction tower, roughly 100 feet in the air, roughly 50 feet off-road. And shortly after engine 708 arrived, ECC says we're now talking to the pilot, and there's 2 people on board the aircraft. And talk about protracted, indeed, 7 hours from the beginning until the time that those 2 were taken out, almost another 3 hours later to get the aircraft safely to the ground and those hazmat or hazards mitigated. A lot of learning. There was great collaboration on this one as well with our public safety partners. There was a lot behind the scenes going on because almost 15 stuck elevator calls throughout the county, automatic fire alarm. Let's talk about the people with home oxygen that now didn't have electricity for that and how that was cascading into a different style of emergency or disaster, while those on the scene are dealing with the complexity of the what and the how. Okay, the tower folks, the transmission tower contractors are coming from practically Delaware. That's a 2-hour delay. It's Sunday evening on a holiday weekend. When those folks got there, they were top-notch and superb. And while they had never experienced an airplane stuck in the tower, as we had not either, they had skills and experience in towers to figure out how to approach it. And they clearly said, yes, the power is off. The breakers have tripped. They've been isolated. But static electricity alone, the wind blowing over those transmission lines, roughly 230,000 volt lines, could and can produce enough static electricity to make your day have a bad ending and give yourself a hair-raising moment, as an example.
And you think about also, if you recall, the fog moved in. It was a little colder up high there, in fact. But, as odd as it sounds, time was in our favor that day, where we knew the people were okay. We were waiting for resources to get in there. As you know, we had plan A, B, C, and D in place. And a lot of, again, time was in our favor, as odd as it sounds, but at the end of the day, of course, it all worked out.
Absolutely, and that's part of the thing is early identification of some of the challenges, early calling of resources, and then having Plan B resources available on site. Because when you need to switch to Plan B, you can't wait another hour or so for other resources to arrive. So great work there. And then, another incident recently, it's a run-of-the-mill incident for some, in our viewpoints, a house fire on Dewey Road, but very good outcome, but a very challenging incident for the homeowners, as an example.
Yeah, and the mailman doing his thing, working, he smelled smoke, I guess, and then as he got close to the home, heard some beeping. Neighbors were, gave him some information. He called 911 right away, of course. He says that he's still on the phone and he hears sirens, so obviously we got there pretty quickly. It was a significant fire. They did find some animals, dogs, very quickly, and who were unconscious and out, and they were resuscitated, revived, and taken to the vet. Good thing. Unfortunately, some cats did not, but the homeowners were not home at the time, and pretty significant fire. So good for the mailman.
And as you said, the crews rescued some family pets and canines with treatment and transport to a vet. Sadly, the cats did not survive. Great work by the crews, added to the patient challenges of canine folks, so good work there. So indeed, in the next couple of weeks, then prior to our next videotaping, there's going to be another odd call or two. That's just things go. So great work for everybody out there.
Yeah, and we've had a number of incidents recently. No surprise to our first responders involving pets. Mostly with good outcomes, but those are things that we have to deal with every day.
And let's talk about every day. So this is December 21st today, Wednesday. As we're taping this, we are in the midst of the holiday season for 2022. We're also in the midst of what some people are calling a tridemic, or the triple impact of cold, flu, and RSV, the predominantly pediatric respiratory issue. There is no doubt that the community is strained by this. We're seeing those upticks. What are you seeing, and as we go about?
Yeah, same thing, of course. And there are things that we learned during the pandemic from a community perspective. Wearing masks, washing hands, covering, up, and things of that nature, and appropriate actions during large gatherings, so on and so forth. Testing is still available. COVID testing is still available throughout the county. Big push on flu shots and COVID boosters. All that's going on. At the same time, our response has been, strained, but not to the point where it's broken yet. I think a lot of what you and the department's done as far as planning with EMS 700 and the supervisors and just our response and working with the hospitals has paid big dividends.
Yeah, and we're going to delve in a little bit more about what Chief Kaufman and Dr. Chismar talked about a couple weeks back. But COVID is still with us. Workforce availability is still strained. This slide shows the number of folks out with COVID on Thanksgiving, which was, just about a month ago, but, 10 people total were out the day of Thanksgiving. 2 weeks later, on December the 8th, as it says, now it's in the 32s. It's up in the 30s. So increase twofold over the Thanksgiving number of 10. And throughout the year of calendar 22, we had gone down to the single digits for a few days here and there, but we had stayed predominantly in the teens and 20s. But we've seen this uptick. So today, as we tape, it's at 37. As we've said, back on December the 7th, when Chief Bailey sent out a note pushing people back to looking at the novel hazard brief. Take as many precautions as you can, take all the precautions as prescribed, both on duty, in station, as well as at home. We will see an uptick after this weekend and the traditional Christmas family gatherings. This time last year, as we taped December 21st, we were at 60 people, so almost double the number of folks that we're dealing with today. And just a simple week later, on December the 28th, we were at 110. So none of us wanted to see a replication of that. Clearly there was a spike. We saw that surge last year and how that Omicron variant kicked in massively. But guys and gals, do the right thing, as we say. Stay home if you're feeling sick, if you're feeling bad, sore throat, all those characteristics. Stay at home, call out sick. When you're at family gatherings or large community events, consider wearing the face mask to help protect yourself, help protect your loved ones. But a lot going on. Everybody keep diligent, stay healthy, and have a good holiday season.
Yeah, and the masks aren't just for COVID. They work for flu and all those other things that might be out there too.
They absolutely work great for flu, as you said. So you were talking about EMS 700, and one of the things I wanted to highlight is exactly that. There's a great Challenges in the Street that was videotaped earlier this month, where Dr. Chismar, the state medical director, and Chief Kaufman and Megan Harrell were sitting in the studio at the Academy and talking about things in EMS, talking about both Maryland's composition of EMS structure, talking about the impacts of EMS 700, also talking about some report guidance or recommendations and experiences, as Megan deals with a lot of report QA as well as records request or records management. So these couple slides that Ben showed during Challenges in the Street really hit the points here. EMS 700 started at the beginning of October. We've seen the drop of wall time, or what also is referred to as drop time. Pretty significant drops have occurred. 4, 5, 10 minutes may not sound like a lot, but as each of you know, the means and ability to not have an hour-long wait or reduce that back down to what had been 20 to 30 minutes is huge for each of you. And we've seen that. And then this other slide, a little bit harder to fathom, but this is a drop times more than 90 minutes. And how many times in a week? Prior to that occurrence, we were running about 30 times a week, having a drop time more than 90 minutes. After EMS 700 started up, we've seen that number get down to roughly 10, so almost a twofold reduction in that number. So great work by the providers, touching base on Alpha 13, this EMS supervisor looking at the screens, making an assessment. Really do appreciate if Ambulance 724, if you go to Holy Cross Germantown or Shady Grove, you're going to be seen much faster versus White Oak or Holy Cross Silver Spring.
And it's not just about us per se, it's for the better care and provision of the patient and the patient's family. So, and if you wrap your arms around it, happens 200-300 times a day where we have the opportunity to transport people to the hospital.
Yep, it's about 175, 200 times a day average over the 75,000 people a year that we transport to the hospital. So it's a large number. Transitioning from EMS to Apparatus. When we last talked on video, the information about where Tower 24 was going had not been decided. I sat with you, Pete, before. I sent out a communication once before. In August, I said here in the video that it wasn't going to 24, and that it was because it didn't fit. Not fitting was a bad choice of words, an inaccurate choice of words, because it fit, it was tight, and it was a recommendation that it not go to 24. Through a lot of additional discussions and analysis over the period between August and early November, as a couple of these pictures show, here's Tower 19 being test fit inside of Station 24. And the clearances are in the 4 to 6 inch range. It's tight, absolutely it's tight. It's equally sized or equally limited margins as some of the other stations are. And back right before Thanksgiving, table conversation at Station 24 and a follow-up communication, Tower 24 is going to Station 24 when the mid-mount 2022 rig comes in. So update on that. My apologies to the folks about the changing of information, but a lot of information had to be reviewed and crunched on. Now, talk about new trucks. There's some new pictures here of what Tower 8. So that was another question. Had you heard that one out there and about?
Well, I hear a lot, and I just don't really give it much thought till I show up to the station and the unit is there. But yeah, there are certainly a lot of new equipment and a lot of moving parts. 24 is a good example of what's going on, but I haven't heard too much about the 8 situation.
So everybody knew practically that either Tower 23 or Tower 8 was going to get replaced based upon the age of trucks, and it just hadn't been determined. So about 2 weeks ago, they were in Wisconsin doing the final inspection on Tower 8. A couple pictures here of Tower 8, midship Tower 8, so it's going to 8. And the next two, which will be 35 and 24, and this set of 4 pictures here is Tower 24 in its last production report. They will be finished very soon, and the trip is the end of January to do the final inspection on 35-24. So great work by the Apparatus committee, the aerial group. There's a picture here that shows, Chase Fabrizio, Brendan Bonita, Danny Dean, Matt Houck, who was present on that trip. Not available to go on that trip was also Jim Schlosser. So great work by those folks, and as we get those vehicles in and Tower 24, 35 rounds out that order of 5, a lot of great work going on, and an appreciation to their hard work. Let's talk about people. You were in Annapolis getting an award here recently. Tell me about it. Yeah,
of course, as you and most folks know, I had an opportunity to be deployed as part of an EMAC to Hurricane Ian. Of course, our Urban Search and Rescue team, Maryland Task Force 1, had been there prior to, and I was able to go down as part of a state-to-state response for a PIO to Fort Myers Beach. And the governor, the Maryland Emergency Management, and the governor took time to recognize us, Brent Miller and myself, and the task force for the response to that hurricane. The day I was originally supposed to be there with Brent, we got called out to Quince Orchard Boulevard, right. So I didn't make it in there. I was fortunate enough that I was invited back by the governor to just the other day to get my citation. So the governor and I go way back. I remember him from his high school days. youngster, and we've worked over the years, but it was a nice visit, and certainly appreciated that I got a governor's citation.
And I appreciate the governor's staff and administration, recognizing yourself and Brent. Brent was part of the IMT for NCR IMT that was down there, as well as the task force. So again, we do every part of these videos to try to do a thanks and recognize the great work. So really appreciate the folks in Annapolis taking the time to recognize the folks that helped those in Florida during EM. There's been some promotions, there's been some changes, so I want to congratulate Assistant Chief James Carpenter on his promotion to Assistant Chief. He's moving to the B-shift duty chief's position for a period of time, which has moved Battalion Chief Pat Stanton to the Fromm's position, which then also opens that spot, which Battalion Chief Jeff Ewert, promoted to Battalion Chief, took the Battalion 3B spot. So congrats to both Jeff, Pat, and James for their new assignments and their promotions respectively. Great work. Now, one of the last things I wanted to touch upon was another part of thanks. And we're dealing with upcoming winter weather tonight/tomorrow. Last week we had one of those as well. Everybody was forecasting. They weren't forecasting snowmageddon again, but they were forecasting nasty precipitation, icing, and a lot of interesting stuff. And school districts in part of the western part and north of here were making determinations at 5 o'clock the day before to close schools. You've seen that before, but it's a kind of an abnormal position for that early.
Yeah, in fact, I was up at the Fire Academy in Emmitsburg in Frederick County, and of course they got a little more, or we're expecting more. And yes, it was a lot of discussion in schools and really paying attention to the weather. But back up to rewind to the airplane situation, talk about schools closing. Because of the widespread power outage, they decided that the night before, and of course Pepco did their great work and got the power back on, but nonetheless, a lot of discussions about not only weather situations, but it is winter. And
with over 200 MCPS facilities in the county, with almost a third of the county without power, it was very prudent to make that decision to limit the late notice possibility of a morning decision. But back to that winter snow event last week, wanted to say that was a great demonstration of your preparedness, the people of the department's preparedness, because as they saw school districts in their hometowns and the predictions, they knew that they needed to be in the morning. So in they come the night before, and when a good number of folks come in 5, 10, almost 12 hours before the beginning of their shift, so that they're in place for their shift or their duty night, that just is a great demonstration of your all's dedication and their dedication to helping their friends and partners be able to get off, be able to go home, as well as help the community. So my great shout out to them for that extra effort, coming to work so early.
And to the command staff and the planning that went into place, certainly we had a lot of contingency plans ready, and equipment and personnel on hold if we needed them, and things worked out as you expect.
So as we're in the middle of Hanukkah for this year, Christmas is right around the corner. Want to say wrap this video up and say thank you for your help this year. Thanks for everybody's hard work in 2022, and see them next year, right?
Yep, see you next year.
All right, take care, stay warm, be safe until next time.